The first mention of cataract surgery dates back to 600 BC. What they did back then was simply take a sharp instrument, go into the eye, and push the cataract out of your central vision and let it fall inside the eye. Now, this didn't remove the cataract out of the eye, it just pushed it deeper into the eye out of your vision. The first true planned cataract extraction where the cataract was actually removed out of the eye was done in 1747 by a French surgeon named Jacques Davio. And since then to now, cataract surgery has truly undergone a revolution. In those times when cataract surgery was done, there was no way of really restoring the patient's vision. Now that's because if you simply remove the cataract but you don't put in a new lens, the patient is not going to have clear vision after the surgery. Since those earliest times to now, there's been advancements in the technique for cataract surgery, in the machinery that we use to extract the cataract, and in the intraocular lenses that we're able to place into the eye after the surgery. In the last 30 to 40 years, the biggest advancements have been in the ability to take out the cataract using ultrasound energy. This allows us to successfully remove the cataract, but do it in a gentle way that retains the natural shape of the eye. On top of that, we can remove the cataract using a sutureless technique, where we make incisions that self-seal after the surgery. Finally, the second biggest advancement is the availability of foldable lenses. These are lenses that we can fold, almost like a taco, and put into the eye through a very tiny incision, the same incision that we use to remove the cataract. Now, in the last 5 to 10 years, there has been significant advancement in the intraocular lens implants that we can offer patients. There are toric lenses, and toric lenses help us correct astigmatism. Many patients have astigmatism, and the simplest way to explain it is that the shape of the eye isn't perfectly round. And during cataract surgery, we're able to correct that using toric lenses. On top of that, most commonly, previously we were able to offer what are called monofocal lenses, and they can help you focus light either at distance or at near, but not both. Nowadays, we can offer what are called multifocal lenses, and they can focus light at 3 key distances that give you a range of vision, and that's the near, intermediate, and distance. However, sometimes these multifocal lenses can lead to some side effects where patients sometimes may complain of the vision quality not being as clear or suffering from side effects like seeing glare and halos. That's where the extended depth of focus lenses come in. These lenses can allow for a range of vision like the multifocal lenses. However, they're not always really great at near. On top of that, they do, however, lessen the potential for side effects while optimizing for visual clarity and quality. The discussions about what type of lens options are right for you really comes down to your lifestyle, what sort of visual outcomes are you looking for, and having a detailed discussion about this with your cataract surgeon. Now that we've covered the lenses that are currently available, I want to share with you what are the recent breakthroughs in 2026 when it comes to cataract surgery. Breakthrough number 1, having the option of potentially using eye drops to slow down cataract progression. Now, everyone after a certain age will develop cataracts, and they progress differently in different people. There isn't much from a therapeutic perspective that I can do. However, there are studies now that are using some topical eye drops that are showing some promise at slowing down the progression of cataracts. These drops are not available to the public, but they are being actively studied. Breakthrough number 2, the use of AI tools in preoperative planning for cataract surgery. When it comes to cataract surgery, my goal as the surgeon is to truly personalize the surgery for you, and that really comes down to picking the right lens for the right patient. At the time of the cataract surgery consultation, we're collecting hundreds, if not thousands of data points, and I can only leverage a few, 10 to maybe 100. However, with the advancements in AI, we can actually take all of the patient data, feed it to AI models, and see what kind of recommendations they make. Now, it is still very early, and I still rely entirely on my clinical judgment. However, in the future, as these AI models improve, it may allow us to weave in the entire picture of the patient in making that decision. And finally, breakthrough number 3, accommodating intraocular lenses. They replicate how your eye and the natural lens inside your eye behaves. Just as a quick recap, your eye develops the cataract inside your natural lens that you're born with. The natural lens that you're born with has the ability to accommodate, where it can change shape depending on whether you're focusing on near objects or distance objects. Now, as the natural lens turns into the cataract, you lose that ability to accommodate, which thereby leads to blurry vision. Now, contrast that to the extended depth of focus lenses or the multifocal lenses, where patients sometimes complain that they have focal points where they can see the clearest. These new accommodating intraocular lenses that are currently in trials may allow you to get a range of vision mimicking how your natural lens behaved in the eye before it turned into the cataract. So there you have it, a brief look at the history of cataract surgery starting all the way in 600 BC to later on in the 1700s in France to now, where not only can we remove the cataract through a tiny little sutureless incision, but we can also put a new lens inside the eye that allows you to see clearly and comfortably. Now, with these breakthroughs that I've outlined, we may be able to offer more options to patients and make the cataract surgery more personalized. As always, my name is Dr. Jovi Boparai. I'm an eye surgeon, and I love sharing eye health information with patients so that they feel informed and empowered. If you enjoyed this video and what I've shared here, definitely like it and hit that subscribe button and share this with somebody that might benefit from it. Take care of your eyes, and we'll see you next time.